I'm back now at 9:21. Here's a statistic for you. Approximately 1/3 of all people older than 65 are going to suffer from a fall this year. And about half the people who are older than 80 will suffer a fall sometime this year. Those numbers are staggering. Well, next week on Tuesday, the 23rd, there's going to be a day to raise awareness. It's a day dubbed National Falls Prevention Awareness Day. You see, from 2005 to 2008, $136 million was spent on hospital costs that were related to falls, and that's just in this state. So it's something we probably need to learn more about. So to talk more about it and show you what you need to know to help avoid falls, I'm happy to be joined now by Megan Rood. She's the Neurological Services Program Director for the Hartford Hospital Rehabilitation Network. Glad you are here.
Thanks for having me.
A pleasure to meet you. Okay, well, I just threw some numbers at people. We don't necessarily like doing that so much. But the other number I'll say is that the rate of fatal falls is approximately 32 times higher for older adults than the rest of us. I think that's something we all know, but we don't really know it.
Absolutely.
How bad of a problem is this?
It's a bad problem. So what we need to do is we need to find these people before they fall. And what we can do is we can educate people on ways that they can prevent these falls. And that's really what National Fall Prevention Awareness Day is about.
Okay.
So some of the education that we do provide for these people is talking with them about removing any hazards in their home, which may include any throw rugs, scatter rugs, extension cords. Talking with them about making sure when they're getting up quickly that they're taking their time so that their blood pressure isn't dropping, and talking with people and educating them about if they're taking more than 4 medications, right there their risk for falls increases.
Sure. That's probably something, those first two things, I guarantee you the first one is something that people have not thought a lot about, because people like to decorate their home. They never stop to think the rug is going to be the one that does you in and you fall down. But talk a little bit more about that. What is it called? Postural hypertension?
Postural hypertension. So what that is you know about your blood pressure. So there's 2 different numbers. And what happens is when you're lying down, your heart gets to a certain resting rate where it doesn't have to work very hard to get the blood up to your head. Now all of a sudden you stand up and your blood pressure needs to increase, and it takes a minute for your heart to kind of catch up.
And you get that dizzy feeling.
Exactly.
We all sort of get.
So for you and me, it's not a problem. For someone else who has some of these other risk factors, it can be more of an issue.
Okay. What are some of the other reasons that cause the falls here?
So other things are, we have 3 different systems that help us with our balance. The first being what we can feel in our legs and our feet and our ankles, our hips and our knees. Second being what we're seeing, and the third is what's going on in our inner ear. So when you're coming to see us for physical therapy, we're able to screen for all of those different ways and different systems to see which one it is that's affected, and then from there we can tailor our treatments.
And let me guess, that has something to do with the box that you all can't see right down here, but I don't think I'm going to like what's about to happen next. I'm just going to guess.
Absolutely.
All right, what are we going to do here? Should I
right.
put this down here?
Certainly.
Oh, thank you, Pete.
So it's just a simple test of 4 different conditions. So the first thing that I'm going to have you do is I'm going to have you stand just with your feet together.
Where, right on the box?
Not yet.
Oh, okay.
Feet together, arms crossed across your chest, and we're just going to stand right here for about 30 seconds. So now when you're standing here right now, you're standing on a nice solid ground and your eyes are open. So you're able to use what you're feeling in your feet and what you're seeing to help with your balance. And you do pretty okay.
So far.
So far. So now what we're going to do is we're going to take away your vision. So I'm going to have you close your eyes.
Okay.
Okay. So this should feel a little bit more difficult.
Yes,
so if we
it does
notice that someone has more difficulty in this situation, we're going to suggest that they turn on a light in the middle of the night, that they make sure that they have night lights, or just to make sure that they're not walking around with their eyes closed or in the dark. But again, you look okay. So, and you've also got accurate information from your feet and your inner ear. So go ahead and open your eyes.
Okay.
So now I can't take away what you're feeling in your feet, but I can make it inaccurate by having you stand right up here onto the foam.
What is that called? Is that proprioception or something where you're feeling your...
Proprioception, exactly. That's a $5 word.
Yeah, I love the $5 words. People always make fun of me for them, but tough. I like being educated. I thought this was a box.
No, it's squishy foam.
You almost made me kill myself right off the bat here. Okay, we're good.
So what I'd like for you to do now is, again, cross your arms across your chest. So now you've got no eyes open. So you have your eyes open, so you have good, accurate visual information, but you've got inaccurate information from your feet.
Okay.
So this mimics, again, washing walking on thick pile carpet,
Sure.
walking on the grass, walking on the beach.
Okay.
And again, if someone has difficulty with this, it could be due to diabetes, due to some type of a peripheral neuropathy. So again, we would educate them to make sure that they are walking on solid ground, making sure, you know, if you are going to be walking outside on the grass, make sure maybe you have a cane or that you have someone with you.
Yeah.
So now the third one.
Okay.
I'm going to have you go ahead and close your eyes.
All right.
All right, so right here now you have no visual information and you're not getting good information from your feet, so you're relying on what's going on in your inner ear.
Yes.
And most people's are not very well developed. So this is usually where we're finding the problem.
Okay.
And now to take it one step further,
Oh,
if you
wonderful.
turn your head side to side,
All right.
I'm just going to make sure you don't fall. You can see how those feet are swaying a lot more.
Yeah, this is harder than it looks because you're not used to standing with your feet this close together.
Exactly.
All right.
Very good. Go right ahead and open your eyes.
Okay.
And go ahead and step off of there.
Well, thank you so much for the time. Unfortunately, we're out of time, and you know, if you took it any further, you'd have to deal with me flat on the ground. So, Megan, thank you so much.
Thank you for having me.
And don't be afraid, folks, to go in and get your balance checked. It's just something that you start to lose as you get older. You can't really avoid it all that much, can you?
Absolutely, but we can improve it.
Okay, there you go. Thank you so much. Coming up next.